am Mansi Singh. My ambition is to become promising postgraduate and efficient professional in hospital and healthcare management, to prove myself as an individual and face the vast world, and to become a career woman. Currently, I am pursuing MBA in Hospital and Healthcare Management from Symbiosis Institute of Health Sciences, Pune, India. I would like to bring forth the limitations and errors in healthcare industry. During this pandemic, we have witnessed the healthcare professionals come as heroes in the eyes of people globally. The healthcare profession is a very noble one, and hence the willingness of the professionals to help the society is to be acknowledged by giving them free hand and resources to serve. Their wings are cut and controlled by the limitations of hospital administrations. I, the student of healthcare administration, is well aware that healthcare professionals are overloaded because of the shortage of staff, which affects the lifestyle of the health professionals, which might affect their work, which results in medical error. This leads to a gap between the healthcare service and the service receivable. The quality and access to healthcare is limited to many people in the developing world. A large body of evidence confirms that poor in the developing countries go without healthcare, which is beneficial to them. There are two sides to the access problem. On the supply side, good quality effective healthcare may not be offered. On the demand side, individuals may not utilize services from which they could benefit. The two are related. Poor quality care will arouse little interest from the public. A high level of demand, which is made effective by purchasing power, will induce the provision of quality care. In 1999, the Institute of Medicine published a landmark report to erase human, building a safer healthcare system. It was for the first time it outlined the extent of preventable harm in the healthcare system. It highlighted that between 44,000 and 98,000 people died every year due to preventable harms in hospitals. I would like to emphasize that the medical errors in today also are as prevalent as in 1999. A report on patient safety from the WHO reads that diagnostic medication errors hurt millions and cost billions of dollars globally every year. The article states that 10% of hospitalized patients are afflicted from hospital-acquired infections and 40% patients are harmed by medical errors. A Harvard study by Professor Jha shows that 5.2 million medical errors are happening in India annually. Similarly, the British Medical Journal quoted that India, like any other developing country, is recording a lot of medical errors. WHO has stated that over 7 million people across the globe suffer from preventable surgical injuries every year. 1 million of them die during or immediately after the surgery. The causes could be surgery at the wrong site, use of infected needles, tainted blood products, or counterfeit drugs. In India, one of the leading causes is shortage of workforce. For example, In Tamil Nadu, we have roughly 45 medical colleges, while in states like Rajasthan, UP, and Bihar, there are around 18 to 22 medical colleges, but the population is more than the double. And also, in some states, the primary health centers are mostly not running properly. I would like to quote a recent example of Bengaluru, where a 56-year-old woman visited a private hospital on May 4, 2020 to get treatment for breathlessness. She was treated as a routine case with a respiratory infection. She was not tested for COVID-19 in spite of government's guidelines, which clearly states that anyone with respiratory problems should be tested for COVID-19. She died on 7th May 2020. A COVID patient died waiting for treatment in Tripura. A man was killed after being sucked into an MRI machine in Mumbai. Private hospital at Gurugram was booked after a coronavirus patient dies due to lack of oxygen. Let's see globally.
What can get lost in the statistics of preventable harm are the stories of each of the individuals that have died. The loss to their loved ones and to their communities often go unheard. Pictured here on your left is Josie King, an 18-month-old little girl who died of dehydration and septic shock from a hospital-acquired infection here at Johns Hopkins Hospital in 2001. How could this occur at one of the top institutions in the United States? It was a result of a complete breakdown of our healthcare system. Josie died because communication broke down between teams. She died because a parent's repeated pleas that her daughter was thirsty were not heard. Pictured here on your right is another story of preventable harm, which includes Ellen Roche. Ellen was a 24-year-old Baltimore resident who loved animals and wanted to become a veterinarian. In 2001, she was a healthy volunteer for an asthma study at Johns Hopkins Baby Medical Center that would measure how healthy lungs respond to a chemical irritant, which was designed to simulate asthmatic conditions. Roche developed a dry cough and needed to be admitted to the intensive care unit the day after she inhaled that chemical. She died of organ failure about 1 month later.
Another report, Crossing the Quality Chasm, was published by IOM in March 2001. It builds on To Err is Human. This report highlighted the need of redesigning the system of healthcare to minimize the human error. Crossing the Quality Chasm does not offer a simple prescription. There is none. It does provide a vision of what is possible and the path that can be taken. It will not be an easy road, but it will be most worthwhile.